Hi, I'm Dr. Chuck. Today we're going to be talking about Alzheimer's disease, or some of us call sometimer's disease. What does that have to do with your mouth? Actually, a lot more than you think. Stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hello, welcome to Your Filthy Mouth. I am Suzanne Lynn with Dr. Chuck, and today we're going to be talking about Alzheimer's and the connection to your mouth. And for some of you, this might be very, very personal because you have family and parents that you see that are starting to kind of go downhill in this way. I've got a friend that it's painful to watch your parents forget things and, lose the current memory and only being able to go back to their childhood and everything. So we want to talk about, is there a connection to the mouth? And can it be reversed?
Well, this is what they've shown. If we think about it logically, the mouth is the front door of the body. Whatever comes into the mouth doesn't stay in the mouth. It goes through the whole body. Mm-hmm. So when you have other bacteria coming into the mouth and it gets into the inflammation, bacteria through the bloodstream, it affects a lot more than just the mouth. And what they've shown, New York University in 2010 did one study about inflammation from periodontal disease and how that affects the brain. And they're showing that there's just from the inflammatory process right there, that can affect people's brains towards Alzheimer's. There was a study not too long ago done in Australia, and they actually have identified bacteria from the mouth in the brain. Porphyromonas gingivalis is one of the bacteria, but it's triggering the production of beta amyloid and doing some of the other bad things. So can the bacteria in your mouth affect your brain? Absolutely. The bacteria in your mouth can affect anything in your whole body. It just happens that now they're beginning to identify what's happening.
So you were talking about inflammation. I'm making the link between inflammation in your mouth and the bacteria that's causing Alzheimer's.
Well, this is what they're... Yeah, again, what they had to say is that, I'll just read it.
Okay.
The research suggests that the cognitivity normal subjects with periodontal inflammation are at an increased risk of lower cognitive function compared to cognitivity normal subjects with little or no periodontal inflammation. In other words, if you got inflammation going on, you got a harder time recognizing and keeping track of information.
And this is affecting the brain. So, is this, say someone's watching and they have a parent with Alzheimer's, maybe the mouth has never been into play before. The doctors are treating the symptoms and they're on medications and everything. But, you're saying that there's a direct link between bacteria in your mouth and the possibility of Alzheimer's. Can you stop it or possibly reverse it?
Well, there are many factors in Alzheimer's, so it's not just from the mouth. But what we can do is what we can do. And if you can clean up the mouth, now you can eliminate one of the factors that's getting into the brains that are affecting some of these things. So, there is a number of factors. This is not the only thing. But again, let's do what we can do. There's some things we can't do. We're not going to change our genetics.
Right.
Okay?
Right.
But there's things we can do. We can certainly keep the mouth a lot cleaner than what we have. And as people get Alzheimer's, they get a little older, sometimes their home care slips a little bit. And so it's important to kind of help on that. Got to choose your battles, though. This is still mom or dad or whoever it is. Of course, I had one fella coming in, a patient, and he was telling me, he says, I'm concerned about my dad. I said, well, what do you mean? He said, he can't remember things like he used to. I said, well, for instance, he said, well, he couldn't even remember what he had for supper last night. So I asked the patient, I said, well, what'd you have for supper last night?
And?
He thought for a couple of minutes, and his next action, it was great. He says, maybe Dad's not as bad as I thought he was. So I think we all kind of have these things, and
and I think it's a fear. Like, oh my gosh, are my parents slipping? Are they heading down that road that's going to be into the deep abyss of nowhere? And it's scary. I guess if you've got a parent, and are you able to approach the doctor, to approach their physician, and say, have you considered the mouth as part of the cause for their Alzheimer's?
Well, including the mouth in all types of diagnoses, not just from Alzheimer's, but from cardiovascular disease, from diabetic complications. There's all kinds of things. We need to include the mouth as a part of the body.
Right.
And that's what we're trying to do, is to get the physicians to get an oral report from the patient's dentist and find out, do we have periodontal disease? Do we have other types of infections that are affecting the body? Do we have airway restrictions that can be affecting things? So, it's a whole lot more than just a pretty smile.
it's got to be brought up to your doctor as a possible cause.
Physicians
And you've got to be
have-
bold, right? I mean,
It's your health.
Right.
It's your family's health. It's your parents' health. And yes, we need to take control. And just like we talk about how do you find a good dentist, well, sometimes you have to do the same thing with physician. Can you communicate? Can you talk with them? Can you ask them questions? Because if you can't do some of those basic things, I know that we have an insurance situation to where they sometimes say you have to go here, you have to go here. But when it comes to your health, I mean, let's do
You go
whatever.
where it's
yeah,
best.
go where it's best.
all right, well, we've got a question of the week, and we're going to get to that next.
Here's Dr. Chuck's question of the week.
Hey, Dr. Chuck, this is Lesley. What age should my child first see a dentist?
Lesley, great question. How young should your child be before they see a dentist? Actually, we like to see the children at about 1 year old, not to see the child.
Do they even have teeth at 1 year?
Yeah, they've got some
Okay.
down there, but
I forget.
not to see the child,
Okay.
but to talk with the parents. This is the training session for the parents. If a child has a cavity before the age of 6, it's the parents' fault, period.
What?
The child doesn't buy the food. The child doesn't brush their teeth. The child doesn't put the bottle in their mouth. The child doesn't do any of those things. It's the parents or the caretaker, whoever that would be.
I'm going to repeat that. If a child has a cavity under the age of 6, it's the parent's fault.
The baby doesn't buy the
Wow.
food. The baby doesn't. So
Okay.
when
All
we
right.
start looking at this, and this is where people talk about
Interesting.
dental care. Dental care is not expensive. Dental neglect is very expensive.
Popping the bottle in the baby's mouth and just, yeah.
That's not okay. I've seen sugar water, milk, Mountain Dew. It's not always a good thing to give the babies, and you wonder why I get those baby bottle teeth. But the whole idea is let's train mom and dad how to take care of those teeth so that as the child gets to 2, 3, 4, by the time they're 6 and 7, they should be pretty able to take care of their own teeth.
Sure.
Hopefully you spend some time training them along the way. And I'm going to bring up disclosing tablets again because that's the only way that you really know if you've done a good job in brushing your teeth. Plaque is the same color as teeth. How do you know you did a good job? Well, you don't. But when you chew up one of those little pills or you put the solution on there and it stains the plaque,
They don't lie.
they don't lie. Thank you
know.
for being our example on that. But this is how we want it. And if we can start the kids at that age and start mom and dad at that age and also start mom and dad on their own teeth. Because if they can start keeping their mouth cleaner, they're going to save all kinds of dental expenses and possibly some medical ones along the way too.
Plus, the kiddos are watching them.
Oh, they don't care what you say. They care what you do.
Yeah.
Kids will watch what you do. Yeah.
All right, so we got the answer, Lesley, and the age is 1.
Yeah.
Thank you.
Yep.
So just like Lesley asked question of the week, let us know. Just go to yourfilthymouth.com and click on the Ask Dr. Chuck button, or you can write in, you can send smoke signals, whatever you want, and we'll send you something fun if we use your question. And yeah, so this week we're talking about Alzheimer's. And if you go to yourfilthymouth.com, we've got some links to some research that Dr. Chuck's talking about. And we'll even put a link to the video about the disclosing tablets because that's
great.
kind of humorous. But Dr. Chuck, so what are the 3 takeaways today for talking about Alzheimer's? What is the dental connection?
Well, the bacteria in your mouth, the inflammation in your mouth from periodontal disease, it affects a lot more than just in the mouth. And they're showing it does affect Alzheimer's. So that's just one of the areas in your body that it affects. And there are other factors with Alzheimer's, not just the oral, but it's a big player, and we need to do what you can about that. So if you have a healthy mouth, keep it healthy. If you don't have a healthy mouth, get it healthy. And that doesn't mean a Hollywood smile. That means no infections going on, either from the teeth or from the gums. Nice airway in there to where you're not snoring at night. You're properly oxygenating your body when you're sleeping. A bite that's doing just right, so you're not putting strain on some of these teeth that can cause a sensitivity on some of the teeth, or also can cause headaches and neck aches. So there's a lot more than just what's happening inside the mouth. It's the whole body.
And that's the message you're trying to share.
Yep.
Is just, keep your mouth clean, go see a good dentist, do what you need to do for home care, because it's affecting way more than just a smile.
Oh, it's so much more than what we were led to believe as we're growing up. You've got the physicians, then you have the dentist. And the mouth, that's just doesn't. It's a huge part of the body. And I tell people, if you think the mouth isn't part of the body, when you go to work on Monday, leave your mouth at home.
Right.
Can't do it.
Right.
Can't do it. So this is the front door. This is where everything comes in. And if you can grasp that that maybe make that paradigm shift to where it's like, oh my gosh, this is where everything is coming into my body. If we can just change behavior a little bit, oh my gosh, the issues that we can prevent and avoid that'd be great.
Don't you find that sometimes people make excuses? Well, it's okay if I don't brush because there's a barrier that's going to keep me, it's going to protect me from myself. Talk about that barrier.
There is no barrier. Back when I was in dental school, they talked about an oral barrier because we went to the instructors. We said, what about the infections of the mouth? Aren't they going to get in the body? No, there's an oral barrier.
Oh, boy.
And then we hear about a blood-brain barrier. Then we hear about a placental barrier. Well, they're finding oral bacteria in the brains of Alzheimer's patients. That's not much of a barrier there.
No, it's not.
They're finding oral bacteria in stillborns from the mother had bad dental situation. The bacteria went right through the placenta to the baby, and the results were not that good. There is no placental barrier.
Wow.
And when it comes to an oral barrier, there is no barrier. So cleanliness is what we've got to do. Again, you don't need a Hollywood smile, but you've got to have that mouth good and clean and healthy.
And some of the basics of doing that, you see, mom and dad slipping a little bit with their memory. What would you, put yourself in their role as a child? What would you do to help them take the first steps to at least have their mouth considered as part of the link to their Alzheimer's?
Well, again, each situation is a little bit unique, a little bit different, but if there's any way you can talk to your folks and say, when was your last dental examination? Let's get your mouth checked out. Let's just make sure everything is healthy in there. Again, it doesn't mean you have to replace every missing tooth or get a Hollywood smile, but it does mean you have to eliminate the bacteria. You have to eliminate the inflammation, the other problems that are going on inside of the mouth, because it's not staying in the mouth.
Right.
Alzheimer's is just one of the things, and all the other areas that it affects. So it's a big deal.
Yeah. Well, we don't want you to miss anything. So, please subscribe to yourfilthymouth.com. And most importantly, share this with your friends and family. We love you. We want you to have a healthy mouth and healthy bodies is really the overall message we're trying to share.
Dental care is not expensive. Dental neglect is very expensive. And that's why we're trying to help people work on the dental care part so you don't have to get to the other. Yeah, it may take a little bit to get caught up, but once you're caught up, man, spend that 5 to 7 minutes every day. It's worth it.
It is.
It's worth it.
It is. Well, thanks for checking in. It's another edition of Your Filthy Mouth.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.